I share deeply the sense of shock and dismay at what has happened to Vicky Phelan and her family, and I commend her courageousness that in some of her darkest hours she has had the strength to fight for justice for herself and, I know, for others also. Let me assure you this afternoon, let me assure you, your mothers, your sisters, your aunts, your cousins, your friends, and your families that I will get to the bottom of this. I have taken swift action and I will continue to take every possible measure necessary to address the serious concerns arising, starting with making an immediate change to a flawed process, which was not ensuring that women were automatically informed of reviews of their own health screens. The government has taken a series of further actions, including the establishment of 2 clinical reviews by international experts, one of the individual cases of women whose screening results were reviewed but who weren't told, and one to conduct an audit of all previous screening results of every woman diagnosed with cervical cancer in the last 10 years. All of the work underway as a result of these actions will, of course, feed in to a wider statutory inquiry on this matter. I want to know what went wrong here. I want to know why 20 minutes before I went into Dáil Éireann, I was given new information that had been kept, not from me, but from the women of Ireland. This is not about it being kept from me, it's about it being kept from the women of Ireland. We are going to get to the bottom of this, whatever it takes to do. I will bring a proposal to government on this next week, and I will also bring a proposal to legislate for mandatory open disclosure for serious reportable events in the health service. Nobody knows better than you the moral and ethical responsibility for all medical professionals to advocate for their patient and to inform them of any errors if they exist. And I'll not be found in wanting in supporting you in the cultural change that we need to see in our health service. No other person should have to go through what Vicky has gone through to get answers to information that directly relates to them. That, in my view, is a fundamental right, and this open disclosure legislation will go some way to preventing this ever happening again. I want to recognise with gratitude that Vicky remains steadfast that the public must still attend these screening programmes in an effort to identify early signs of cancer. Whilst we... And I thank you for that, because whilst we recognise the flaws and the weaknesses that have been identified and we work to fix them, we cannot lose what we have here, which is a life-saving programme that has detected more than 50,000 pre-cancers in Irish women and has saved lives. So I know some of you here that I'm addressing today may well be involved in carrying out the screening service. You're already too aware of the impact that this has had on your service, but I do seek your support this afternoon in reassuring the public and continuing to deliver this important work. This week also drew to a close with the Portiuncula report, which stimulates in all of us a deep sadness for the families involved. I want to say that out of great tragedy and pain, we are ensuring that we learn, that we change, and that we improve. This is evident locally in the increased numbers of clinical nursing and midwifery staff at the hospital, and nationally in very real progress being made since the publication of our first ever national maternity strategy and the establishment of a national women and infants health programme. And I thank you all for the vital role that you play. I suspect that many people here and many that you represent in the nursing and midwifery profession throughout this country are weary. You're weary of hearing how valued you are whilst feeling exactly the opposite on a daily basis. So I'm not going to do that. I want to be honest, and I want to say that I genuinely recognise the pressure of the circumstances you work in, and the care you deliver in these circumstances means so much to so many. I know you want to make the environment in which you practice your profession a better one, and I want to do that too. We face the reality of a global shortage of nurses and midwives. It is by no means lost on me how highly sought after Irish nurses are in this fiercely competitive market. The recruitment moratorium that was put in place from 2007 has had a real and lasting and painful impact on staffing levels, with some specialties, including midwifery, particularly affected. While there has been some progress in increasing nursing numbers, our current reliance on agency workers and overtime is certainly not a tenable solution. Under the recruitment and retention agreement that we agreed last year, the HSE agreed to appoint 1,224 additional nurses and midwives. In 2017, they filled 942 of these. A key contributor has been offering permanent posts to graduate nurses. For me, moving away from the days where we were unable to even offer our own graduates a job in the Irish Health Service was a key and important moment. Having come from years where we weren't recruiting staff to years where we have begun to fill nursing posts is indeed an achievement, but obviously we have an awful lot more to do, and we will do more. I'm pleased to say that in 2018, the 2018 nursing and midwife graduates will also be offered permanent posts, and work is already underway to communicate this. But I'm well aware, and if I wasn't, you've made me even more aware, that while we're asking people to stay, they're asking about pay. And trust me, I hear you on this. I want to work with you on this. I understand the depth of our recruitment and retention challenge, and your calls for pay to be part of our efforts to meet it are indeed legitimate. That is why we got agreement that this would specifically be considered by the Pay Commission, and it is why your organisation was invited to contribute to a specific module, the first module, on nurses and midwives and other health service staff. The conclusion of this module is now imminent, and I look forward to the report in June. We must and we will act on this then. Meanwhile, efforts have begun to restore pay over the last couple of years, starting with the lowest pay. But I know that the impact of the budget cuts made during the financial crisis have been painful. The nursing and midwifery workforce suffered pay cuts, increment freezes, a moratorium on recruitment. People were asked to do more with less for less, and that takes a real toll. The measures agreed in the Public Service Stability Agreement provide a statutory roadmap for the unwinding of FEMPI and for pay restoration. This includes a series of salary restorations that will see public servants, including nurses and midwives, receiving an average of 7% restoration over the lifetime of the agreement. Calls for pay parity for all new entrants are being addressed as part of another process being led by the Department of Public Expenditure and Reform. This led to the Minister for Finance providing a report to the Oireachtas on its findings. The report made clear the government's commitment to working with the parties to address these issues while mindful that we must work out a way of doing it. An initial meeting was chaired only last week by the Department of Public Expenditure and Reform, at which the INMO attended, and further engagement is now planned to progress the matter of new entrant pay. We are very aware that we also need to plan for the future of the workforce. My department, along with key stakeholders, recently invested significant effort in producing Working Together for Health, a national strategic framework for health and social care workforce planning. My department does many things well, but short and snappy titles are not one of them. But implementation and resourcing of this new framework will strengthen our workforce planning, and early actions are now underway. To that end, and thinking of future needs, last year an additional 130 nursing undergraduate places were made available in the nursing degree programme. We now have the highest number of nurse training places in the history of our state. The reality is, though, I can't talk to you this afternoon about my desire to improve the environment in which you work without talking about increasing capacity, and that means more beds and more staff. The health capacity review found that very clearly. I know that most often the need to increase capacity manifests in the overcrowded emergency departments, and this has consequences for you personally and for the care that you wish to provide. I'd like to thank your new General Secretary Phil and your previous General Secretary Liam for their work as joint co-chair of the ED Task Force and the collaborative contribution that the INMO makes through them to develop measures aimed at alleviating pressures. I want to acknowledge the particular difficulties we've experienced in the last number of months. We have opened additional beds this year, and we will open more. My department is now working with the HSE to identify the location and the mix of beds across the hospital system, which can be opened and staffed this year and into 2019 in order to improve overcrowding. The capacity review concluded that the system will need nearly 2,600 additional hospital beds and 4,500 additional community beds. I'm pleased to say that these beds are now funded and funded for early delivery. I will never understand who or why the decision was made long before the Troika were in town that we had too many beds in the Irish Health Service. If you reduce the number of beds at the time the population is growing, you can't exactly be surprised when we don't have enough beds. So we will reverse the failed ideology and failed policies of the past, which reduced bed numbers. But to do that, and to do that properly, we have to make sure we can have appropriate levels of staffing so we can actually open them. So we need to work together to do that, and we have started that already, because we now have a new task force on safe nurse staffing and skill mix, a task force and a framework that has been endorsed by your organisation, but not only endorsed by your organisation, which you've helped to develop. We now have the evidence base to answer that age-old question: how many nurses or what other health skills do you need on a ward? We can't just make it up as we go along. We have to have the evidence base. How many nurses do we need in each ward? And that's why we have our new framework for safe nurse staffing and skill mix. I do genuinely want to thank you, Phil and Martina, for your work in developing this. This new plan will determine the number and type of nurses needed in each hospital ward around the country. During the pilot stage of this framework, it demonstrated significant benefits for both patients and staff. The framework led to increased quality of care, decreased length of stay in hospital, increased satisfaction with the care received, while staff reported an increase in job satisfaction. There's also been a sustained decrease of up to 95% in the use of agency staff, and we're also now seeing a promising trend in relation to reduced mortality rates as well. So we know that this framework clearly works. So the next step now is to roll it out nationally. We need a national implementation plan, and I'm pleased to announce today that I'm now setting aside new funding to appoint a safe staffing coordinator beginning with each of our level 4 hospitals. I'm also now providing additional funding to develop a national ICT system to support the rollout of this framework to every hospital in the country. Following a procurement process for this ICT system, we'll begin rolling it out to all Model 4 hospitals commencing this year. This framework will stabilise the nursing resource and will continue to have a positive impact on patient outcomes. And I'm also pleased to announce today that the Phase 2 pilot testing of this framework in an emergency care setting will begin this year across 4 sites, and these 4 sites will be identified and announced in the coming weeks. We're also developing a series of demonstrator projects to show how a critical number of advanced nurse practitioners can contribute to providing a solution to a number of the challenges we're facing in our health service, including access to services, avoiding unnecessary hospital admittance, supporting early discharge, and contributing to addressing waiting lists. 20 ANPs commenced their education programme last October in the areas of chronic disease management, older persons care, and unscheduled care. Methods of data collection to demonstrate the impact of the policy have been agreed and distributed to the candidate ANPs. I welcome the theme of this year's conference: innovation in practice, nurses and midwives leading the way. I was pleased to hear of a number of innovative practices being undertaken by some of your members, and I know there were a number of presentations on this yesterday. One of these important presentations was on the Sexual Assault Treatment Unit service. A few weeks ago, I had the pleasure of meeting some of your members, some of the nurses working in these units, and to hear of the incredible work they do in providing care to women who have been victims of the most appalling and horrific crime. At the meeting, I heard about the many developments that have taken place since the O'Shea report on the service was published in 2006. Much has thankfully been achieved since then, but it is now high time for a further review of service provision. And today, I'm addressing something that the INMO have been campaigning for some time, and I'm announcing that I will initiate stakeholder engagement on a new national policy for sexual assault treatment units, and I would really welcome your support in this regard. I want to welcome the pioneering efforts evident in the presentations you have had to put the patient at the centre and to develop the services around them in changing times, be it the innovative ways of cutting waiting lists or the work of community intervention teams. These innovative projects tie very well in with the Sláinte Care reforms. This is the first time in the history of the state that we have had a cross-party consensus on how to develop our health service and health policy in Ireland. And people can get a bit cynical about that, and I get that. But it is an unprecedented opportunity, and we shouldn't squander it, whereby politicians in Dáil Éireann, regardless of what party they're in, have said, no matter who wins the election, whenever that is, many, many years away, no matter who the Minister for Health is, and hopefully that doesn't change for many years either, no matter who the Minister is or who's in government, this is the plan. And that allows people working in the health service have a certainty of the direction of travel. It allows patients have a certainty of the direction of travel, and we shouldn't squander that. We've got to get this right. But fundamentally, Sláinte Care isn't just about systems or structures. It's about putting the patient at the centre. It's about delivering care that is timely, is free at the point of delivery, and is provided at the most appropriate, cost-effective service level, with an emphasis not just on how we deal with people when they get sick, but also on illness prevention and population health. This is moving towards a system that places primary and community care at the heart of healthcare delivery, shifting it away where possible from the acute hospital model. You will all understand the challenges facing us in making this shift to primary care a reality. We will need more resources in the community, and we'll also need to make better use of the resources we already have to have. I want to say that I'm particularly conscious today of the importance of clinical governance in the light of recent events, and I'm very much aware of your motion earlier today. And I want to assure you and state clearly here at this INMO conference that I will not be making any changes to the managerial structures in relation to community nursing. And let me also say, when changes are meant to be made in part of the health service, it should be done in a way that is collaborative and respectful, and not in a way that causes unease, concern, upset, and disrespect. We want to make real improvements in our health service, improvements for patients, but also improvements for the people working in our health service. Staff representative bodies are critical to ensuring the engagement and fair treatment of staff, and are an important stakeholder in achieving change. I believe that achieving the vision of Sláinte Care will require a new model of meaningful engagement with trade unions that recognises their values and ensures that employees and their representatives are fully involved at any stage of reform. The scale of that challenge should not be underestimated, but I believe you're up for it, and I can assure you that I certainly am. Returning to the theme of your conference today, the late Steve Jobs once said that innovation is the ability to see change as an opportunity and not a threat. As we work towards implementing Sláinte Care and all that it will bring, we do so knowing that for us, change is not just an opportunity or a threat. It is an imperative. We have to change and improve our health service. Even in the context of change, though, some things remain constant. And one of these is the absolutely integral nature of your profession to the health service now and the health service of the future. I look forward to us moving to the next stage of this journey together. So I want to conclude by how I began, by thanking you for the invitation to be here with you today. I want to thank the INMO for their constructive engagement. We have a lot of work to do, whether it's on pay, working conditions, capacity, or reform, and I want to assure you that in me, you have a willing partner. Gur míle maith.